Hi friends, I'm Dr. Hari Narayan and I'm going to talk to you about myopia today. Myopia has become an epidemic in today's time. Every other kid has become myopic. What do you mean by this? It just means that they are short-sighted. They can see things near, they can't see things far. They can't see the blackboard in school, so they require glasses to see. So you have this what is called minus number in glasses and they wear it, and once they wear those glasses, they can see everything crystal clear. Often this is missed. Parents don't address this issue, they don't take care of it, they don't understand that the eye is affected. The child may not be listening to them, or the child may not be performing well in school, or the child may not be writing properly. We assume that the handwriting is bad, we just scold him to write properly. Essentially, he can't see. So this myopia is starting at a tender age and goes on increasing, and often patients come at a much later age. Okay. My point is not to just keep on talking about myopia here. I'm trying to tell you that in myopes, often even the retina, the back part of the eye is affected. What happens in myopia is the eyeball has become bigger. So in these patients, often there are multiple holes or lattices in the retina. So they need to be screened. The patient or the kid or the adult is not going to complain anything. As long as they're wearing their glasses, they will see everything crystal clear. Okay. And post LASIK, which nowadays has become quite common, that they get rid of their glass spar. So the glass spar has gone. Okay. Mind my words. The glass spar, which was -3 or -5, has become 0. That doesn't mean that the retina has become normal. They would continue to require retinal evaluation every year. They continue to have the same risk of retinal problems which those kids or those patients who have not undergone LASIK, they have. So they may have these holes or lattices, in which case they may require laser or not. That is a decision left to the doctor who is going to evaluate them. And occasionally some of them may develop sudden loss of vision. This happens when there is a retinal detachment that happens. It can happen to anybody. We don't know why it happens. All we can say is there is a hole in the retina that led to a retinal detachment. Trauma can cause it, aggravate it, or per se myopia itself is an isolated risk factor for retinal detachment. So you need screening, and in case you lose your vision, you have to address it instantaneously. Go to the doctor, consult a retina doctor. Please remember, don't just consult any optometrist or any ophthalmologist. A retina specialist needs to be seen, and then if required, surgery needs to be done in case of a retinal detachment. The results are excellent if addressed early. Okay, so bottom line, if you are a myope, you need retina screening. So first diagnose the myopia, get it corrected, and also get your retina screened periodically. Thank you.